Hello, everybody, and welcome back to the Here For You podcast. I am your host, your moderator, your professional geek, Carlos Parra, and I am once again with my co-host, my expert, the doctor that has the wealth of knowledge, Dr. Cristi Moore. Welcome.
Hi. Hi there. Thank you for having me.
Oh, thank you for always being on here. We absolutely love it. You are a wealth of knowledge, and so today you're going to share something with us that is, I find this fascinating and very interesting. But why would somebody who needs their hearing tested, hearing aids, why would they search for an audiologist?
Yeah, that is a great question. A lot of times people find that they can't hear well. They'll always search for maybe hearing aids or hearing help or some sort of assistive device, but they may not know to search specifically for an audiologist. And the reason why is that some people don't always know, what does an audiologist do? What makes us different? An audiologist is a hearing care professional. The minimum training that we have is usually a master's degree or a doctoral degree. And so we go to school for a very long time to learn not only about about hearing aids and technology, but also about the auditory system, how hearing is related to the brain function. It's actually a very complex system. And so we study a lot of anatomy, physiology, psychology, etc. So we have a lot of education behind that degree. So when we come out, we can diagnose all types of hearing issues, whether it's hearing loss just due to aging, whether there's other medical conditions such as Meniere's or balance disorders, ringing in the ears. All of those types of diseases and disorders are things that can make sometimes your hearing problem much more complex. And so that's where audiologists have a lot more comprehensive training in those areas, in addition to helping provide you with a solution to meet your hearing needs, most oftentimes through the use of hearing aids, assistive devices, cochlear implants. So that's one of the main differences, or one of the main reasons why someone may want to seek their assistance from an audiologist.
Awesome. Okay, so so that leads to a lot, and so this is very interesting, and it leads to me to think about going, it's just not about the device, right? It's just not about using the technology, because if you are able to, dig further into that person's, the physical disabilities that have started to develop, you're actually able to help them overcome those, and it just not rely on the technology, but more so on learning what's going on with their body and how you're able to help them.
That's exactly right. We know that, I always tell people that hearing aids are a tool that we use to rehabilitate the auditory system to learn how to hear again. It's a brain function. The brain actually has to learn how to recognize sounds that it has not been picking up for a very long time. And that can be a process that can take months, years, for all of that to start working again. So the hearing aids provide that information by allowing us to input the sound through the microphones. The amplifiers amplify that sound after the digital computer has processed that sound. And then it's recognized again as auditory signal, where the ears are no longer able to pick up those sounds on their own. This just aids that signal along and helps the brain, then the auditory centers in the brain, to help remember or to recognize that signal somewhat. So it's a process, and that's why it's very important that you have a knowledgeable professional that understands that there's more than just putting a hearing aid on the ears and saying, okay, here you go, program it real quick and send you out the door. It's a rehabilitative process, meaning that you need to do the work. You need to wear the devices, but you also have to practice listening. So we want you to practice listening to speech, talking to others, listening to recorded speech, such as audiobooks, things like that, watching TV with a closed caption on. Those are all good things that help you to learn how to hear again and process language like you did before.
Interesting. Thank you so much for that. So obviously you have your doctorate, you go to school for many years to learn about, you know, the brain and how it's working with our hearing. So let's take this out a bit further, right? Where people have the option of going online, of going to essentially a big box store like Sam's Club. Are there any like requirement? Do they have to be doctors to sell and work on these hearing, the people's hearing?
No, there's no requirement that you have to be a doctorate of audiology or an audiologist to work in a large retail type place that sells hearing devices. A lot of those places do employ dispensers or hearing instrument specialists, and those individuals are specially trained to test your hearing for the purpose of recommending a hearing aid. So they don't have the same education that an audiologist has. They may have a bachelor's degree. They may have another degree in something else completely unrelated to hearing and balance. But they do have to complete a minimum number of hours, and that's state dependent. They do have to take a test, which tests their knowledge about hearing aids and those basics, and then pass that test in order to receive their license in order to dispense and fit hearing aids.
You can have that professional that has studied the human brain, that has studied hearing, has studied, you know, how the human body acts to sound and thought and how it's receiving, or you can have somebody take the device and sell it to you.
There's maybe a little more to it than that. So the audiologist, yes, we can fit hearing aids, and that's a lot of what we do, because if we're going to diagnose and treat you and talk to you about hearing loss and what that means and how serious it can be if you don't, the long-term health impacts that it has, then yes, we're going to recommend a solution, which a lot of times does involved fitting hearing aids, assistive devices, cochlear implants, etc. So yes, we have not only that education on what your auditory system can do or can't do, but we also have that knowledge too, where someone who is a dispenser, just because they don't have that degree doesn't mean that they don't always know and understand the mechanics of hearing devices, and that they aren't knowledgeable in that part of it. They just don't have that other layer of education background with that. So their knowledge and their education may be limited compared to that of an audiologist.
Interesting. Okay, so more so of, you know, where that is more of your quote unquote quick fix, where you guys are actually, it's more growth and therapy and relearning and being able to address those particular symptoms and help your
Right.
clients grow with that and learn and relearn.
Right.
Awesome.
Right.
That is fantastic. So much knowledge. I just appreciate you for just sharing this knowledge, sharing it with our viewers, and just really educating of going, this is this is why you should search for an audiologist.
Yeah.
And this is why you remove I need the tool, the hearing aid, the earwax removal, where you should be searching for the doctors of audiology or an audiologist.
Right. Right.
Yeah, that way you are getting the correct treatment with the person that has the most knowledge about the human body.
Exactly. That's
awesome.
right.
Dr. Moore, thank you so much for your time. As always, I appreciate it. And viewers, please like, subscribe, click the little notification bell. So every time a video goes live, you are receiving an email. You are notified saying, hey, there's a new episode. And we're going to do a series similar to this, where we're going to be expanding on the knowledge of what an audiologist does and their services. And that way you can kind of become very familiar with what an audiologist does and how they go above and beyond what the common knowledge is. So Dr. Moore, again, thank you very much for your time.
Thanks. Bye.